What is a lumbar puncture for leukemia? Imagine a tiny window into the central nervous system that helps doctors understand how leukemia is affecting the body. That window is created through a procedure called a lumbar puncture, or spinal tap. This test is especially important in leukemia cases because leukemia can sometimes spread into the central nervous system, which includes the brain and spinal cord. Detecting this spread early can make a big difference in treatment planning. During a lumbar puncture, the patient usually lies on their side with knees drawn up toward the chest. This position helps open up the spaces between the bones of the spine. The doctor then cleans the lower back area and numbs it with a local anesthetic to reduce discomfort. A thin, hollow needle is carefully inserted between two vertebrae into the spinal canal, which is the fluid-filled space surrounding the spinal cord. Once the needle is in place, a small amount of cerebrospinal fluid is withdrawn. This fluid is the clear, protective liquid that surrounds the brain and spinal cord. The cerebrospinal fluid collected is sent to a laboratory where specialists look for leukemia cells. Finding leukemia cells in the fluid confirms that the disease has spread into the central nervous system. The test can also measure the pressure of the cerebrospinal fluid, providing additional clues about the health of the nervous system. Sometimes, the lumbar puncture is used not only for diagnosis but also for treatment. Doctors can inject chemotherapy drugs directly into the cerebrospinal fluid to target leukemia cells in the central nervous system, helping to prevent or treat disease spread. While the procedure is generally safe, some patients might experience mild side effects like headaches, which often improve with rest and hydration. Discomfort at the puncture site is also common but usually temporary. The importance of this test lies in its ability to give a clear picture of whether leukemia has reached the brain or spinal cord, which influences how doctors decide to treat the disease. In summary, a lumbar puncture for leukemia is a vital diagnostic and treatment tool. It helps detect whether leukemia has invaded the central nervous system by analyzing the cerebrospinal fluid. It can also be used to deliver targeted chemotherapy directly into the fluid surrounding the brain and spinal cord. This procedure plays a key role in staging the disease and shaping effective treatment plans. Always remember, if you or someone you know is undergoing this procedure, consulting with healthcare professionals ensures personalized care tailored to individual needs.